and welcome to my channel. My name is Jazzy RN. I've been a remote utilization review nurse for over 9 years. I've worked for 3 different companies, and the goal of my channel is to help nurses pivot from the bedside to remote. And today's video is going to show you more about the CVS Health jobs and how to navigate the applying for these jobs and how to also edit your resume to where you'll be picked for an interview. So basically, you go to CVS Health. On the top right hand corner, you'll see careers. In the search bar, you're just going to type in nurse. That's what I did. And then scroll to the bottom where it says work location. Click on remote. And then for me, what I did was type in utilization review. And it basically came back with 13 results. So the first job we'll go over is utilization management nurse consultant. And the first thing I always look at is the qualifications before I apply. So the first qualification is an active unrestricted RN license. Make sure your resume says education and then the name of your college, and then you can put dash or colon, active, comma, unrestricted RN license. If you also want to include if it's a compact or a multi-state license, that's also an option. Make sure your resume reflects 3 years of acute hospital clinical experience. Now they actually prefer Med-Surg or ICU. Now if you only have behavioral health experience, this is not eligible. Now these next 4 bullet points can all be combined into maybe a 3 or 4 sentence summary. And a summary will be located right below where your name, your state and city, your email address, and phone number is located. So it can be at the very top of your resume, right below your primary information. So I would say combine these 4 bullet points into one summary. These are basically, most of these are actually soft skills that you already have at the bedside. Now I want to explain the multitasking across multiple screens. Whenever you work remotely, the insurance company or whatever hospital you work for will provide you with a laptop and 2 monitors. And they will also provide you with a headset to make phone calls and receive phone calls, a mouse, keyboard, and docking station. The docking station just basically connects all your equipment together. Some companies have it to where the docking station is located inside one of the monitors, which will be the primary monitor. And you'll actually use that primary monitor to connect your laptop and all monitors and additional devices to your computer. Next is the preferred qualifications. Now they prefer, it's not required, 1 year of utilization review experience, 1 year of managed care experience, proficiency in Microsoft Office, Word, Excel, PowerPoint, and Outlook. Now, as a nurse, you already have experience in Office. You've actually learned it with nursing school or in high school. But regarding Excel and PowerPoint, I have never ever used PowerPoint remotely. Excel, I have used it for one job, and basically they had us, let's say we were working authorization, and we had to enter the time we started and the time we finished. They were very particular in basically monitoring how much time we spent on each authorization. But this company wasn't as advanced with their tracking system. I know that the other 2 companies I've worked for use Power BI, and Power BI tracks what you're doing. So they can tell how your productivity is going with how much time you're spending on each authorizations or how many you work per hour. And these last 2 bullet points, strong telephonic communication skills, demonstrated ability to exercise sound judgment and collaborate diverse teams. That can be also included in a summary, which is a part of these bottom 4 bullet points here. And they also require you to have an associate's degree in nursing. That's required, and it's preferred to have a bachelor's degree in nursing, but that's not required. I also want to include one more thing. If you are selected for an interview for this job, you want to look at the description itself to figure out what type of questions you'll ask in the interview process. This is because you don't have any prior experience working remotely in utilization management. So this bullet point right here where it says collecting and evaluating clinical information, applying clinical criteria, guidelines, policies, and judgment to make coverage determinations. Let's say during your interview process, you can ask the interviewer, whenever I'm collecting clinical information, am I collecting it via fax? So that means am I sending a fax to the hospital? Am I calling the hospital to get verbal clinicals, or do I have access to electronic medical records? Now, because if you don't currently have any experience in utilization management, you wouldn't know the exact questions to ask. So that's why it's best to look at the job description to figure out which questions are best to ask to the hiring manager or whoever it is interviewing you. The next job is utilization management nurse consultant. Now this has qualifications for you must have an active current, an unrestricted RN license, and state of residence. So I would say for your resume, you can put education, and then the college name, colon or dash, and then active current and unrestricted RN license in the state of, let's say, Texas. Make sure your resume actually reflects 3 years of acute hospital clinical experience as an RN. So the ability to use a computer station with multiple screens, like we discussed earlier, operate multiple programs simultaneously, and sit for extended periods of time. So multiple programs simultaneously is, let's say, for example, your main program you work would be Epic. I'm just going to say that for example. And then additional program you would work is, let's say, Microsoft Outlook for your email, and then Microsoft OneNote or Word for your documentation. You could also be using WebEx for your phone calls. So that's considered multiple programs simultaneously, as well as Microsoft Teams, which is not like email, but it's like basically it's instant messaging. It's very quick, and sometimes whenever you are working remotely, some people on the Teams, Microsoft Teams, kind of get overhand with their conversations. So just make sure you're not paying too much attention to Microsoft Teams, because it can get to be a little bit not frustrating but distracting. Make sure you have a private designated workspace free of distractions and high-speed internet. Now, I've never had anyone come to my home to confirm that my workspace was free of distractions. Some companies will ask to do a high-speed internet test, and it's basically a website that will actually go to confirm your speed test. And the ability to work Monday through Friday, 8 to 5 a.m. Eastern Time, with occasional weekend, on-call, and holiday rotation. Now, I've never had an on-call requirement for a job I've worked with, but I had to work occasional weekends and holiday rotations, which I don't mind. And here are the preferred qualifications. You must possess strong customer service skills, attention to customer sensitivity to certain issues, and proactive identification or resolution of issues, experience with all types of Microsoft Office, including PowerPoint, Excel, and Word. And once again, I've never used PowerPoint as a nurse. Only Word, mostly is Word, and then sometimes Excel. Strong telephonic communication skills, so you may be making a lot of phone calls or receiving phone calls. But for me, the jobs I've had, I rarely would get phone calls, and when I did get phone calls, it was regarding a denial. And of course, nurses can never deny an authorization. If we can't approve it through Interqual or MCG, we send to a doctor, and it's a doctor's decision to either approve or deny the authorization. And they prefer, is not required, of 1 year utilization review experience and 1 year of managed care experience. And of course, education is associate's degree is required, and a BSN is preferred. Also, I want to include that if you do have a BSN in nursing, I would just say just type BSN. Don't type Bachelor of Science in Nursing. I don't see the words Bachelor of Science in Nursing on the job description anywhere. So if you think about ATS, Applicant Tracking System, it doesn't clinically think that BSN is the same thing as Bachelor of Science in Nursing. Basically, the system is looking for BSN. If it doesn't see BSN, it will assume we don't have a BSN, even if you had the word Bachelor of Science of Nursing in there. So back to the position summary. This is a 100% remote position. This position doesn't have a lot of details about what you'll be doing, but just make sure that whenever you do get an interview for the job, you ask questions that are based on the job description or position summary. So right here where it says through the use of clinical tools and information data review, the nurse consultant reviews services to assure medical necessity, applies clinical expertise to assure appropriate benefit utilization, facilitates safe and efficient discharge planning, and works closely with facilities and providers to meet complex needs of the member. I would say for this position, you can always ask the interviewer, Does this role use Interqual or MCG? I have more experience with Interqual. It's basically a platform that helps insurance providers and hospitals determine medical necessity. So most companies use Interqual or MCG. Out of all three companies I've worked for, all three have used Interqual. Only one had used MCG for a short period of time. They started with Interqual, went to MCG for like a year or so, and then went back to Interqual. I also want to include, I have a list here of over 60 companies that hire remote nurses, and I have the website URL in the description box below. I do want to point out that there's one company in particular you want to avoid. Now this list has also some notes that says some of these jobs are for physicians, some are for nurse practitioners, some are actually hiring nurses who live in the Philippines or work for American companies. That's very common. The name of the company is called Lensa. You will see lots of jobs posted by Lensa, but you never want to apply directly. I do recall seeing someone post on Reddit that they applied through Lensa and then they started being spammed. So whenever you do see a Lensa job, if you look at the job description itself, it'll say what company that's actually doing the hiring. Sometimes it's United Healthcare or Aetna, Molina Healthcare. Don't apply directly to Lensa. Just go to let's say United Healthcare's website and find the job that way. I also want to mention that instead of doom scrolling on LinkedIn and looking for jobs there, a good idea is to set up job alerts through the company websites. So since we are already at CVS Health, if you go to the main website, and right here you'll see where it says get tailored job recommendations based on your interests. You can get started here. And if you also scroll down to the very bottom, it's also here as well. Join our talent community to get alerts on the latest job openings. So basically here you'll upload your resume and you can enter information on the website, and you will get emails directly to your email address regarding jobs that are compatible to what you are selecting. So let's say your area of interest, and you can put clinical here. And this will prevent you from not only doom scrolling on LinkedIn looking for jobs, but a lot of times whenever you do see jobs on LinkedIn, the job has been posted for a couple of hours, and sometimes you'll see over 100 applicants have already applied. So with going through the company website and the job alerts, because you'll get the job as soon as the job is posted on their website, you can beat the rush and be the first one to apply.